every single woman should be doing self-breast exams every month. Best time to do that is about a week after your period. Get to know, the main purpose is for people to get to know what their breast tissue feels like. Everyone's is different, but once you get to know what it feels like, you know what it feels like if there's something wrong. So that's important for any woman to start age 18 every month doing breast self-exams. Second one is clinical breast exams, either by a nurse or your physician. Do that once a year, usually, starting at age 18 as well. And then mammograms begin around age 40, and that's something you should do every year. Follow up with your mammograms, and if they see anything from that point, they may recommend further screening, but if everything looks normal, you just continue up with that screening protocol. Clinical breast exams starting at age 18 as well every year. And then the mammograms usually begin a little bit earlier if you've had a family history of breast cancer. Usually we like to begin those about 5 to 10 years earlier than the earliest age of diagnosis in the family. So the general population starts at age 40. Let's say you have a parent, your mom had breast cancer at 45. Well, that's a little bit earlier than we would expect to see it, and so you may want to start your mammograms around age 35. It's also important to talk to your doctor about whether diagnostic mammograms would be beneficial for you. That basically can include an ultrasound and additional images of the breast tissue so they can kind of get a better look and see if there's anything happening based on your family history. Depending on how many people in your family have had breast cancer or what your personal risk is, your doctor may also recommend a breast MRI every year. Self-breast exams begin at age 18, do those every month. Clinical breast exams starting at age 18 as well. The general population does that usually once a year. For these high-risk women, we recommend doing that twice a year if possible. We also start mammograms much earlier than the general population. If a woman knows that they have a BRCA1 or 2 mutation, we want them to start diagnostic mammograms at age 25 instead of at age 40. Those can be a little bit tricky because mammograms look for densities, and young women have very dense breast tissue. So in addition to those diagnostic mammograms, we add in a breast MRI every year for those women as well. It's important because we want to make sure that the women with a BRCA1 or 2 mutation have some sort of imaging every 6 months. So you only do each technique once a year, but let's say you do your mammograms every January, then you need to do your MRIs every July. That's just so we can get the most accurate imaging that we can and try to catch anything as early as possible. We also talk to those women about surgical options. These women can have up to an 85% lifetime risk of developing breast cancer. So we talk about the option for a prophylactic mastectomy or the option to remove their breast tissue before any cancer happens.